Assalamualaikum. My name is Wan Sofia Atika. All of you can call me Teacher Sofia. So for today's lesson, I will present to you about the topic of bioethics. There is 5 subtopics in this topic of bioethics. The first one is the introduction to bioethics. The second one is the theory of ethics. The third one is the principle of bioethics. The fourth one is the scope of bioethics. And the fifth one is the sub-disciplines in bioethics. Introduction to bioethics. Bioethics was introduced by Van Rensselaer in 1970s for study aiming at ensuring the preservation of the biosphere. Bioethics is the study of the ethical issues emerging from advances in biology and medicine. Bioethicists are concerned with the ethical questions that arise in relationship among the life science, biotechnology, medicines, politics, law, and philosophy. It includes the study of values relating to primary care and other branches of medicine. Bioethics also helps to establish a common ground for different views, the democratic process being facilitated by the principle of giving equal and fair consideration to all sides or aspects of a given issue concerning human, animal, and environmental rights. Theory of ethics. There is 3 theories of ethics, which is the utilitarian ethic, deontological ethic, and the virtual ethic. Utilitarian ethic. The first ethical system is the normative ethics. Utilitarianism is often equated with the concept of the greatest good for the greatest number. The idea is that ethical decisions are made based on the consequence of action, which is why it is also sometimes called consequentialism. The attraction of this ethical perspective may lie in the fact that it appears to be a way to weigh out the impact behavior and determine the greatest good for the greatest number. There are 3 main concerns that seem to arise when public relations professionals rely on utilitarian ethics to make decisions. First, rather than looking at the choice action itself, decision makers are forced to guess the potential outcomes of their choice in order to determine what is ethical. In other words, ethics should be about the decision-making process, not just the outcome, since it cannot be guaranteed. Second, utilitarian ethics also presents question of conflict with regard to which segment of society should be considered most important in weighing the good or outcome. The third objection is that it is not always possible to predict the outcome of an action. In other words, consequences of actions can be highly volatile, impossible to predict. So, the utilitarian ethics is about to make a decision based on what will benefit the majority. Deontological ethics. The second prominent concept of deontological ethics is associated with the father of modern deontology, Immanuel Kant. He was known for the categorical imperative that looks for transcendent principles that apply to all humans. The idea is that human beings should be treated with dignity and respect because they have rights. In deontological ethics, people have a duty to respect other people's rights and treat them accordingly. When faced with ethical situations, the process is simply one of identifying one's duty and making the appropriate decision. The challenges to this perspective include: first, conflict that arise when there is not an agreement about the principle involved in the decisions. Second, the implications of making a right choice that has bad consequences. And third, what decisions should be made when duties conflict. However, despite these concerns, many have found that deontology provides the strongest model for applied public relations ethics. Virtual ethics. Finally, a third one and growing area of philosophical reasoning with ethics is known as virtual ethics, the one that has gained more attention in public relations scholarship in recent years. The philosophy stems from Aristotle and is based on the virtues of the person making a decision. The consideration in virtual ethics is essentially what makes a good person or what makes a good public relations professional. Virtual ethics require the decision maker to understand what virtues are good for public relations, and then decisions are made in light of those particular virtues. For an example, if the virtue of honesty is the what's important to good public relations professional, then all decisions should be made ethically to ensure honesty is preserved. Okay, so now let's look at the pros and cons of ethics. For the utilitarian ethic, there is no pros, but there is a cons, which is the decision makers are forced to guess outcome, harming a minority and benefiting majority, not always possible to predict decision outcome. For the deontological ethic, there is a pro, which is the strongest model for applied public relations ethic. As for the cons, there is a disagreement about principle of making decision, right choice with bad consequences, and the conflict in duties. For the virtue ethics, there is no pro but there is a cons, which is missed important obligation towards client and publics, and possibility of conflict in virtue. Principle of bioethics. There is four principles of bioethics. There is an autonomy, beneficence, non-malfeasance, and justice. As for the autonomy, the right of the individual to make decisions regarding their own health must be respected. As for the beneficence, the healthcare providers must strive to benefit their patients. And the third one is the non-malfeasance. The healthcare providers must not hurt their patients. And the fourth one is the justice. The patients should share more or less equally in the costs and benefits of the healthcare system. Scopes of bioethics. There is three scopes of bioethics. The first one is the Human Genome Project. The second one is the stem cell research. And the third one is the artificial reproductive technology. Human Genome Project. History of the Human Genome Project. It was begun in 1990. It was a large-scale global project that involved research teams in 20 different countries, allocated over $3 billion in public sector funding alone. It was completed in the year of 2003, which has 2 years earlier than predicted. Human reproductive technologies assist in human reproduction of sperm donor, ovum donor, or surrogate mother. The controversy of the sperm bank is the privacy of the parent versus child's right to know his genetic father. Give social implications such as screening for genetic disease, genetic matching, stigmatization, and insurance companies. As for the genetic screening, we can detect diseases such as Huntington's disease, hemophilia, cystic fibrosis, and also cancer. Genetic screening also allows doctors to make better decisions when considering what medication to prescribe to patients. As for insurance companies, the genetic information denying right of health and life insurance. Stem cell research. Stem cells are naturally occurring in the human body. They repair and revive other cells to replace dead tissue and can divide to take place of cells that have specific function. Stem cells can be used to repair a multitude of problems and have been used by scientists to help with the effect of Alzheimer's, heart disease, spinal cord injuries. Scientists also believe that stem cells can be used to treat birth defect and defeat cancer. Controversy involved with stem cell research, as stem cell research can be done with adult stem cells. However, embryonic stem cells have proven to be more effective. Some others claim the destruction of the embryo is the only way to obtain these stem cells, but there are still others who dispute this claim. Artificial reproductive technology. Artificial reproductive technology is called umbrella to describe the different technology in the reproduction of new life. The technology includes tree technology, which is in vitro fertilization, gamete intrafallopian transfer, and the zygote intrafallopian transfer. Subdisciplines of bioethics. There is three subdisciplines of bioethics, which is the medical ethic, animal ethic, and environmental ethic. Medical ethic. The practice of medicine is rooted in a covenant trust among patient, healthcare professionals, and society. The ethics of medicine must seek to balance the healthcare professional responsibility to each patient and the professional collective obligation to all who need medical care. Application of this principle might be problematic since some people might disagree about to act in this situation. The importance of medical ethics. The study of ethics prepare medical professionals to recognize difficult situations and to deal with them in a rational and principled manner. Ethics is important in physician interactions with society and their colleagues and for the conduct of medical research. Medical ethics involve examining a specific problem, usually a clinical case, and using value, facts, and logic to decide what the best course of action should be. Animal ethics. Animal ethics is a branch of ethics that examines human-animal relationship, moral consideration of animals, and how non-human animals ought to be treated. The first animal rights laws were introduced in 1635 until 1780. The three R's were first introduced in a 1959 book called The Principle of Human Experimental Technique by zoology W.M.S. Russell. The three R's stand for replacement, reduction, and refinement, and the guiding principle for the ethical treatment of animals used for testing and experimentation. As for the first one is the replacement. Avoiding using an animal for testing by switching out the animal for something non-living such as computer model or an animal which is less susceptible to pain in relation to the experiment. The second one is the reduction. Devising a plan to use the fewest animals possible, a combination of using fewer animals to gain sufficient data and maximizing the amount of data from each animal to use fewer animals. And lastly is the refinement, a decrease in any unnecessary pain inflicted on the animal, adapting experimental procedure to minimize suffering. Lastly is the environmental ethics. Environmental ethics is the study of relation of human being and the environment and how ethics play a role in this. Environmental ethics is an established field of practical philosophy. It involves few issues such as global warming, climate change, deforestation, pollution, resource degradation, and the threat of extinction.